Okay, so thank you for joining me. I'd actually like to tell you about the virtual reality benefits for mental health. Now, in the previous video, I showed you the headset and I showed you how it actually is to be fixed. But yeah, I want to talk about the good benefits that you're going to derive by using virtual reality. Now, don't forget that what we're trying to do here what I'm trying to do here is to actually show you our new virtual reality therapy product, right? But also let you know how important and how effective it is. For some people, this is the first time that they are hearing anything about virtual reality therapy, while for some, they've heard about it for so long. And so, the essence of this particular course or video is to tell you about it and the benefits that are there for you. So let's come along. So, what is virtual reality? Virtual reality is a dynamic environment through technology that creates in the user the feeling of being immersed in it. So, you have to read the environment generated by computer. It gives you the possibility to interact. So, you have user actions that have repercussion of visual environment, multisensory stimulation, and then you have the experiences that are similar to real life. So you can generate emotions, you can generate thoughts, you can generate similar reactions. So it's just basically it gets into an environment and you feel immersed in it and you're able to see yourself in that environment. It allows you to immerse yourself into the environment. And you can do the same thing that you'd have done in real life. But what this just means is that you are not there physically, right? But you can see yourself in a 3D environment. And to better understand virtual reality, you need to know these basic concepts. So, what is immersion? Right? Immersion is the perception of being physically present, right, in a non-physical world. So you're physically present, but in a non-physical world, um, in the sense that you don't need to be there physically, but you're physically present. And this happens when you put on the virtual reality glasses, right? The perception is created by surrounding the user of the VR system in images, sound, and other stimuli that provide an engrossing total environment. Now, you have the sense of presence. That's another one that you put on and that concept, which is when we are watching a movie or reading a book and we are so focused on the story that external stimuli are no longer important. So, immersion and a sense of presence are two key elements that are needed for you to have a successful virtual reality therapy. And that's how we use what's called an e-sense, right? Use what we call an e-sense so that you can have that feeling in which everything that's happening extra no longer matters to you. You have that sense of presence that you're present in that aspect, in that particular environment, all right, and then you feel immersed in it. Physically, um, you have that perception, but you're not there physically. Now, this is a research that has been on for 25 years in different parts of the world. It was known as an environment simulation technology, originally used by military and aviators for their training. But then Jaron Lanier was one of the first to use the term virtual reality, defining it as a technology that seeks to stimulate real and fantasy scenarios in order to generate the feeling of being present in this environment in a virtual way. So imagine wherever you're watching this particular video from. I am doing this from Nigeria, from Lagos, Nigeria. If I want to have an experience of what it is like to be in Brazil, all I need to do is to create an environment that and then wear my glasses, my 3D glasses, my VR glasses, and I find myself in an environment in Brazil, period. And so in 1985, the first scientific study to use in therapy was created. And don't forget that virtual reality had been used by some before, but by aviators and all that. But this time around, in 1985, it was applied to therapy. And so you have from the researchers to the clinical practice. So different papers have gone out talking about VR, clinical VR applications. You can see the journey of scientific research until it was finally accepted. So the research and scientific papers on the validation of VR in therapy have grown exponentially in 25 years. Um, 25 years of scientific study. support the results of this technology for the treatment of multiple disorders. You can see from 1985, one, and then like that, like that, like that. And by 2017, we had 949 research papers supporting it. Now, what are the benefits of VR therapy? The acceleration of therapeutic process. You have the acceleration of therapeutic process. It makes therapeutic process easier. It makes therapeutic process. Okay, so let me explain to you. In virtual reality, right? Virtual reality, the acceleration of therapeutic processes um, can achieve something extra that traditional therapies do not have. Okay, so in psychology, VR therapists can achieve something extra that traditional therapies do not have. The main benefit, right? The main benefit is that patients notice the environment faster, and that is something that everyone is looking for today. Everyone wants to improve. Everyone wants to get well fast. I doubt if there's anybody who doesn't want to get well fast. I doubt if there's anybody who wants to stay on the hospital bed longer than usual. Everybody wants to get well fast. Everybody wants to leave the hospital ward faster, right? And so the main benefit is that patients notice an improvement faster, and that is something that everyone uh, wants to experience. That's something everybody wants to be a part of. Okay, and so that has enhanced the embrace of what do you call it now? The embrace of virtual reality therapy. Another thing is you have a more controlled environment. So this creates greater peace of mind for the therapist and the patient. It creates greater peace of mind for the therapist and the patients. Um, this allows that all variables can be controlled. And of course, when you're doing in vivo is when you have to put things that you cannot control all the environment. As you see now, you cannot control all the environment. But in this case, you can actually control the environment in which everything is happening, right? Another thing is you have exact repetition. So you can repeat a scene. Okay, you can repeat a scene for therapeutic purposes as many times as you want without altering any variant or by changing anything. Like you don't need to change anything. The environment are there already. So there is nothing for you to change. There is nothing that you are taking away from it. The environment are there already. I mean, on our own application, we have about 70 environments. So you pick which one you want and can repeat the same environment for someone again. You don't necessarily have to, you don't have to um, create it all over again. No, it's already there. I can just simply repeat. And then number four, no training imagination required. The therapist does not need to achieve a certain situation. Everything will already be done by the virtual environment. All that the person just needs to do is just sit down, stay calm, and follow the instruction of the therapist. No special training whatsoever. No need to start teaching the patient to imagine. In hypnosis, in hypnotherapy, you have to tell the client or the patient to imagine themselves in a particular scenario, imagine yourself in a particular environment. But this time around, you don't need to tell the patient or the client to imagine anything. The environment is there. Wear the headset and you're good to go. Or if the person is using the Android phone in which we have the app, the person can still practice that as well. Let's also look at another benefit, which is customized solution situations rather. It is not because the scenario was designed thinking in a specific phobia. It doesn't mean that it can only be used for that phobia. So environments are situations that can be adapted to work for different disorders and situations with patients. For example, you can put on the agoraphobia environment in the subway, and you can work PTSD with patients who have suffered some kind of trauma in the subway or on the plane. So yes, an environment has been created, but you cannot use that environment for different purposes. So you have someone who says, look, I have issues with fear. And maybe the person's fear is when he or she sits in the middle on the bus, right? But it doesn't mean that you can only use it to give that person a feeling of sitting on the bus. You can use it to help that person who feels some kind of trauma when he or she is walking in the subway or on the plane or by the pedestrian side of the road. So the point is you can customize the situations, right? Next one is inclusion of difficult to access scenarios. Like the cost is reduced because you don't have to buy a light ticket and fly. You don't even need to move away from your house to actually use this, especially with the coming up of the app. You can actually sit where you are and use the app with your Android phone and get access to this environment. Of course, it requires that your therapist needs. So the point is the cost is reduced because it's not necessary to buy airline tickets. For example, to work on the fear of flying, that's another angle. You don't need to say, let me climb on a plane to find out if I'm going to experience this fear. No, because these different situations and environment take you through that process and that experience. Then you have greater privacy. The patient feels more comfortable and confident knowing that he is alone in the therapy room, that he has privacy, and that there are no people other than the therapist watching him as he performs the exposure. So there is that sense of security, that sense of privacy. Every client wants privacy. Every client wants to be sure that whatever it is that is happening, no other person is looking at him or her. All right. Then you have the therapist patient shared screen. Yeah, through the platform, the therapist can see what the patient is experiencing at all time, right? And you can even see what he is not seeing. So, for example, there's an environment called the fear of public speaking. We can know if the patient looks at the public when he speaks or not. So, this and too many. Another one is less intrusive and better accepted. You're not putting in any needle whatsoever. You're not giving any injection whatsoever. You're not intruding the person's privacy at all. Right? The patient knows from the beginning that they are computer created environment and they won't experience any intense in vivo exposure. There's nobody that is experiencing any form of exposure whatsoever because the patient or the client knows that these are computer created environments. So there is no harm that would happen in that environment. There's greater adherence to treatment because you would enjoy it, right? It does well for all ages, children, young people, and young adults. They get hooked faster to therapies using technology. And so it's also something that you also need to watch to be sure that they don't make it a lifestyle that every time they want to put it on, and not when it's not even necessary. Okay, so you need to pay attention to that as well. But the truth of the matter is they get used to it fast, especially children and young adults. And then you have complement or alternative to pharmacological treatment. So it's not replacing any type of medication, right? But it's possible to reduce the medication levels, okay, because it supplements this therapy. It supplements medication when you use this therapy. So, what are the types of intervention? You have techniques to decrease activation, such as breathing relaxation. You have that for coping with exogenic situations and stress, such as systemic sensitization, gradual exposure, anger management training, stress inoculation. And you have techniques based on social learning, you have social skills training, you have vocally, they have cognitive therapy. This is designed for patients who do not have specific phobia, but rather some type of generalized anxiety. So you have anxiety at work, you can use virtual environment on the subway and give him the idea that he is walking to work. Under cognitive therapies, you have rational emotive therapy, Beck cognitive therapy, problem solving therapy. Then you have executive functioning to work sustained attention and working memories, for example, in ADHD, dementia, stress. Of course, you have third generation therapies, e.g., mindfulness. Mindfulness is a third generation therapy. Then you have EMDR. This is an environment where the patient will experience a feeling of relaxation, while the therapist will be able to add an element such as a sphere or a ring to guide the movement, the ocular movement. It's a useful therapy that allows you to work both remotely and in person. Then you have hypnosis. Now, all the techniques implemented in virtual reality therapy have been scientifically validated, right? Nobody just woke up and just, let's start. They've been scientifically validated and mostly based on cognitive behavioral therapies, but it's also possible to work with other techniques like therapies based on social learning, e.g., for people with Asperger's or social anxiety. And so the idea is to bring the patient into this controlled environment so that it's easier to replicate the thoughts that arise in these situations and to work with them. So intervention proposals according to disorders, you have panic, generalized anxiety, PTSD, anxiety disorders, specific phobias, social anxiety, sleeping problems, impulse control disorders. And then you have, so here you have intervention according to disorders, and then you have ADHD as well. So mindfulness environment can be used for treatment of ADHD since its effects are related to focus and attention. So after evaluating various clinical cases of patients with ADHD, network of experts have found it helpful to complement therapy with other virtual reality environments, such as the pain distraction environment to improve concentration, the relaxing environment that helps calm the nerves, and the diaphragmatic breathing environment. Then you have that of OCD. This one is used as a response prevention therapy, where the patient must face extremely dirty and contaminated scenarios. If you met someone who truly has OCD, you would understand this. Then there is eating disorders, where we offer evaluative environments, for example, in a restaurant, where it's evaluated what goes through the patient's mind when exposed to a problematic eating situation. And of course, you have emotion focused therapies, you have that of chronic pain. Now, so at Rock Consulting, we are offering this service to you because we believe that it is important that technology takes the center stage. We focus so much on technology, and we believe that we can use technology to solve a number of issues. We offer virtual therapies, and so this is just an additional form of technique, so to speak, such that we bring than just much more than just the ongoing therapy that we offer, be it CBT, be it psychotherapy, and so we introduce that. So we provide these solutions to you. We offer you the tools of phobia, treatment, anxiety, and a host of other things. It is a sincere belief that as much as possible, you're going to embrace this and understand that you don't need to break the bank for you to use virtual reality. You don't need to break the bank for you to actually have this experience. The most important thing is that you are open to it and you're willing to actually test it, right? And so it's available for you, it's available for everybody. It's not meant for just a specific set of people, right? It's actually meant for anyone and everyone who is open to embracing technology as a whole. Everyone who is open to embrace technology as a whole, you can actually have access to it. So you have the environment catalog, what it looks like, environment catalog, session configuration, real reports, right? You have real reports, and then you have online environment. So you can see all the environments, yeah, the environment catalog, got 70 of them, and then you can configure the session, enter the patient's name, uh, um, put in the patient's details and all that, the claims and all that, control what experiences they would have, and a host of other things. And then you can generate real-time reports. All right. And so you have the online report as well. So you can see the environment. For example, relaxed environment, you have relaxed mindfulness, distraction, fear of public speaking, stress. For anxiety, you have fear of animals, fear of driving, fear of needles, fear of darkness, all the fears you can mention. For other disorders, you have eating disorders, you have EMDR, you have OCD. And of course, there is a sensor that we make use of. Okay, so this sensor is connected to your fingers to have a sense of what is going on, within you. It is used to convert information related to the body so that it is understandable to the mind, and so that through exercises, learn to control body signals. It works through the recording of skin conductance, which depends directly on the state of activation or relaxation of the patient. So it's going to rise if you're not relaxed. The therapist guides the patient in modifying the neurovegetative responses and achieve more regulated and appropriate behaviors that provide a faster and more suitable change over time. So yeah, like I said, there's also the app, which you can see right here. The app is called Tiles at Home, right? The new solution in which with your phone, right, you can access this service. You don't have to come to where we are, right, to use the headset. With the app on your Android phone, you can actually get access to this platform. All you need to do is pick up your Android phone and download Sales at Home. Right. At the moment you log in, going to give you a code that you send to your therapist that he or she is going to make use of. So that is the advancement that we're bringing to you. That you don't necessarily have to be with the person. It's enough wherever you are. Okay, you can actually make use of this product. So I hope that this explains a whole lot about this product to you, and I hope that you understand um, that this service is available to everyone, and it's a service that we are proud and, and glad that we're able to bring. I hope that you are open to it and that you embrace it and you're willing to